do you want to stand up there?
Whatever you want to do. Yeah, this will be a video up here, so you could stand up here if you want to. Got it. So we're live. Yeah. So then when he goes, we'll switch it. Actually, hold on a second. I'm gonna mute this. Yeah, they've had like so many variables just now displayed. Yeah. I'll make sure the audio is working. We're actually look to the test. Test. Yeah. Yeah, you can hear us. So. Look at it, like what play the video. So, yeah, that's fine. Okay. Test. Okay. So anything that's attached to the computer. So this stuff. Here's the back. So it's the camera and the laptop, and really anything that's attached here is attached to this because everything's attached. Yeah, the extension cords, anything that's attached. Anything that's attached. And this isn't working. We don't have enough ports for this. I don't know why that's not.
You have to share this.
And I'm like, learn all it's hard. But I never thought about it.
Yeah, we fixed that. It's not we just have to, we have like three. So Amy's has like some different font in it. So we can't just put it in our slides.
Okay.
And then his we can't get his get it onto the computer.
That stinks.
So he's going to present on his laptop. He's on the Zoom meeting, and then he's going to show on his laptop.
So how's that gonna affect like our YouTube channel?
Nothing.
Nothing.
It's still streamed through there, so
Okay.
everything will work. The one thing was yeah, we'll figure it out.
Okay. All right.
Good morning and welcome to the Franklin County Public Health and Primary One Health's Quarterly Community Health Advocacy Forum. We are happy to have each of you here this morning. These forums are designed to provide information to our community members, to our partner organizations on how we can better improve the health outcomes of our community residents. We look at not only healthcare, direct service care to individuals, but also those social drivers that impact the health outcomes of our residents. We've got a panel today, and as you can see from the title, our focus is on nutrition. So this event today is focused on Nutrition Nexus, bridging food insecurity and social drivers of health. I'm Charlita Tavares, the CEO of Primary One Health, and with me and our co-sponsor is Franklin County Public Health and our Health Commissioner, Joe Mazzola, who is sitting in the back. He'll come back up here in a little bit, but I'm going to introduce the first presenter at this morning's forum. And the first presenter is Dr. Joshua Joseph, who is a physician and founder and medical director for the Ohio State University Wexner Medical Center Healthy Community Center. He is going to open up today's program, and we're going to have the audience share any questions before he has to leave. Unfortunately for him, his son's soccer team, which he coaches, switched the game up from second, move the time, to first. So he's going to have to leave out of here after his presentation. So we will take a few questions before he has to leave. Dr. Joseph?
Good. Well, thank you so much for the kind introduction there and the invitation. You know, clearly when Charlita Tavares and Joe Mazzola send you email and say, hey, come present, you're going to be there to present, right? So I'm super excited to be here, super excited to share some of the work that we've been doing. Let's figure out how to get this on here. Perfect. And so, you know, I'm a professor at Ohio State, do a lot of work around nutrition security with a great group of people, the Accelerate Research Group that I'll talk a bit about today. These are the disclosures. The objectives today are discuss, you know, why we must bridge food, you know, insecurity and social drivers of health. Why is that, you know, a really critical conversation? And then we're going to explore some strategies to do just that. So I'll start with, this is our team, the Accelerate Research Group, and our real goal is to advance cardiometabolic health equity. And clearly within that, you know, there are the lifestyle behaviors, things like physical activity, nutrition, dietary quality, etc., that are so critical to cardiometabolic health. In our group, we do a lot of work on epidemiology, looking at big data and how we can use big data, quality improvement, health system to community interventions, and then community-based participatory research. Our roof is health equity, and our foundation is truly academic, community, government, industry partnerships. So we spend a lot of time fostering those partnerships, and there's a lot of great partners in the room today, and you'll see their logos as we go throughout. And so this is our team. We're a big, diverse team of folks, and just proud to engage with all these individuals every day. Today we have Dr. Amaris Williams with us in the back, as well as Jenny Schroeds, registered dietitian in the back as well. And so many of you know I'm president-elect of the American Heart Association board here, and get to work with Joe Mazzola on that board as well, and many others of you. And the American Heart Association really has a vision around improving health, you know, everyone having an opportunity to lead long, healthy lives. And there was a policy statement a couple of years ago looking at strengthening U.S. food policies and programs to promote equity and nutrition security. And so you may be wondering, what is nutrition security, right? We talk a lot about food security, someone having enough food in their homes to eat. But when we think about nutrition security, we're really adding in not only that food security part, we're thinking about what is the quality of the diet, and then what are the equitable approaches within that. So food security is having enough calories, and nutrition security is having the right calories. And why this is critical is when we look at individuals with that are living with food insecurity, what we know is that they actually eat a similar number of calories. It's really the quality of those calories that changes. And so there's a huge focus on the American Heart Association on advancing nutrition security. And when we think about Central Ohio, in our group, we work in many different neighborhoods, but one of them is the 43203 zip code. This is the near east side of Columbus. This is where we have OSU Hospital East. We also have primary care centers in this area as well. And this is also where the Healthy Community Center is as well. And so in that community, 1 in 5 individuals, unfortunately, is challenged with food insecurity. And when you break that out, when we think about that nexus between, food as well as those other social drivers, 8% of people are saying that they're having to choose between food and paying for medicine or medical care. And almost 16% are choosing between buying food or paying their rent, right? Which really speaks to that nexus between kind of food, nutrition, as well as those other social drivers of health that are so critical. And when we look at nutrition just in general, what we know is only 40% of Franklin County residents stated that they eat fruit less than 1 time per day, right? So 4 out of 10 individuals here in Franklin County, and 26% of individuals said they eat vegetables less than 1 time per day. So clearly an opportunity for improvement in that. But we have to get there. We have to provide access and education and all the pieces that we need to do to get there. And why this is critical is that we know that food is a huge social driver of health, and that, food security, nutrition security, access to healthy options are all key to long-term health outcomes, which we're all trying to achieve so that everyone can lead longer, healthier lives. But they are part of the interplay with these other social drivers of health that are listed on this slide. The example I usually use is that, if you don't have a car, you don't have transportation, and there's no bus route, it may be very difficult to get to the store to purchase food, right? If your utilities are off at home, then it's hard to cook food, right? So these things all have an interplay together. And so I mentioned earlier that we think a lot about partnerships, and this is a slide from our Health Equity Through Diversity Conference. I know many of you came to the conference and the speakers and different pieces. But at this conference, we really talked about how do we align and partner. And some of the things that came out of that was the importance of real listening. In sessions and forums just like this, how do we hear from people, listen, take that, distill it down, and develop programming together? And the importance within that of shared governance. So in all the programs that we do, we develop these groups that actually lead the interventions, right? And those are inclusive of patients, families, partners in the community, and as well as our community partners and our government industry partners as well. And so the last thing I'll say is right in the middle of that slide, you see the importance of centering on community. And I think that that's really the importance of having these conversations right in the community. Right, we're not at some governmental building downtown. Right, we are right here in the community. And for me, this is a community that I love. I went to Columbus Alternative High School, which is just a few blocks away from here. So it's just wonderful seeing the Linden Community Center and all that it has become over time. And so in our group, we think about, the socio-ecological model is what we call this, but it's thinking about the individual, interpersonal, organizational, community, and public policy levers that we can use in order to advance health and to advance health behaviors. And as part of that, we really think about our interventions and our programming targeting individuals or focusing on individuals, but also the interpersonal piece, their family members, their community members, their friends, the organizational pieces, the community pieces, and then ultimately trying to go upstream to do the public policy work as well. And so one of these programs is called LINK. This is linking education, produce provision, and referrals to improve diabetes care. And within LINK, we are thinking about individuals with uncontrolled diabetes and food insecurity. being the two kind of entry criteria for the program. And we have kind of 4 arms in this study that we're doing. The first arm is the food pharmacy program, and I'm going to talk about that. The second arm is kind of the food pharmacy program plus cooking matters for diabetes. The third arm is the food pharmacy program and the health impact of Ohio hub. So this is the Pathways Community Health model. I'm going to dive into that. And then the fourth arm is like the Cadillac arm. I grew up in the 80s, so I call that the Cadillac arm. You get all 3 things, right? And we're trying to understand, hey, what is the dose that is needed to improve food and food behaviors, right? Can you give food alone, or do you need food and cooking education? Or do you need food plus a community health worker to address other social needs, etc. So the Mid-Ohio Pharmacy is a partnership with the Mid-Ohio Food Collective, and Amy Headings is sitting right here. And the goal is to connect individuals with food, those community resources at food banks really throughout Central Ohio. And the food pantry list just continues to grow week by week. I feel like we have the list and there's another new one, which is excellent because we know that's really, really important to get food to individuals. The second part is actually led by Jenny Schroeds, who's here today, and that's Cooking Matters for Diabetes. This is a 6-week class where we do both diabetes education and culinary education at the same time. Many of you in healthcare know it's sometimes hard to get individuals to go to diabetes education. So this is a fun way to do that, to engage with individuals around cooking, to build communities. And it's really, from my standpoint and watching it, just a beautiful program to see those relationships build over the course of the 6 weeks. And then the third part, the Health Impact Ohio and the Central Ohio Pathways Hub. And this is a program where we put in a referral to the hub. Individuals are contacted by a community health worker. A lot of times, the community health worker will go out to their house, screen them on over 20 different social needs, and then engage with them in pathways to address those social needs. And so the average age of individuals in our program is about 56 years. You can see the race, ethnicities, and then also kind of working status of the individuals in the programs. And when people start, the average A1C is about 9.4%. So kind of much above the control levels that we're shooting for. Another program that we do is called Black Impact. And this is really looking at physical activity and how it reduces the effects of psychosocial stress and improves cardiovascular health. You see all the partners across the bottom there. We co-developed this program initially with the African American Male Wellness Agency, along with multiple other partners that you see on the screen. And the basis of this program is the American Heart Association's Life's Essential 80, which you can see number 1 on that list is eating better, right? How do we continue to improve dietary intake, along with the other factors that we know promote long-term cardiovascular health. And so we screen individuals, Black men in this program, at the African American Male Wellness Walk every year. As all of you in the room know, huge walk, over 20,000 individuals. Last year, we screened over 1,200 Black men at the walk. So it's a huge effort to advance health through health screenings. We look for men who have kind of poor cardiovascular health. We use a Life's Essential 8 score for that. And then we engage them in the Black Impact Program, which is a 24-week program where they go to Columbus Recreation and Park Community Centers. So right now it is Far East, Lozelle, Wood, Blackburn. They go to the center. We do 45 minutes of health education and then 45 minutes of physical activity, which is led by a personal trainer. The health education is either led by a physician or a nurse. And it's the education is around the diabetes prevention program, which is a nutrition heavy program, as well as the AHA check change control blood pressure program. And so we also engage people with primary care. And I think that, I'll just say out loud, that's a potential opportunity for partnership. We have Black men who need primary care providers. Primary One Health is a great organization for primary care, right? So how do we engage? We already engaged with Ohio Health in that manner as well as Ohio State. And I know people in the room are like, oh, you work with Ohio Health and Ohio State? Yes, we do, right? We work with everyone because improving the health of communities is all of our work together. And in this program, the average age of the men is 53 years. You can see the kind of working status, BMI, as well as sleep and some of the other factors that we examine at baseline for the men. And then on the right side, you see that's Chef Mike doing a cooking demonstration with the men, right? And they're doing chicken sliders that night. The men love the chicken sliders. And then at the bottom right of the screen, you'll see we had a community celebration, and you see we're practicing what we're preaching there with, carrots. The thing in the middle looks like mac and cheese, but it's cauliflower mac and cheese, which was actually tremendous. So practicing what we preach as well. A program that is upcoming that we just got kind of funding for is the Healthcare by Food. It's called Sustain. And you see the partners there, including the Mid-Ohio Food Collective. And in this program, we will be working with individuals who have already have cardiometabolic diseases like hypertension and diabetes and metabolic syndrome, and getting them Instacart as a platform. They'll get Instacart for 8 weeks, and then Instacart optionally for 8 weeks, and then the Mid-Ohio Food Collective Food Pharmacy program as well. But we have a registered dietitian that's going to be working with them on nutrition behavior change, as well as we have a community health worker to address social needs. So once again, you see this kind of same nexus of things that we continue to do, where we're addressing not only nutrition, but really thinking about how do we address those social drivers of health as well. And I realize I need to update the Black impact on top of that slide. We'll get to that. The next one is a diabetes friendly cooking demo. So Jenny Shrills is here today. Every other Tuesday, she has this diabetes friendly cooking demo. It's her and then a chef. They prepare 1 to 2 recipes. It takes about 20 minutes, and people can hop in at their lunchtime or kind of go in, and it's incredible. The food that they make is incredible. The community they build is incredible, and just a great program, open to all. And the QR code is listed there. Well, you can't see the QR code, but we have the QR code. If you need the QR code, we have it for you. And then a couple of my last slides are we have the Wexner Medical Center Healthy Community Center. And the grand opening for this is May 8th at 4:30. We'd love to have you out. You've officially been invited now. It's at 1600 East Long Street. And this is a building, there's no clinical care. It is fully, based on how can we improve nutrition and wellness are the 2 big pieces of this building. So we have a huge demonstration kitchen. We have a healthy retail cafe, 2 community rooms, as well as an innovation space. And it's open for partnership, collaboration. If you're a health system, if you're a community organization, whatever you are, we want to collaborate, but collaborating directly with community members as well in this space. And the quote that we have on the wall is from Martin Luther King, because this was the first Martin Luther King Jr. library in the country, is I have the audacity to believe that people everywhere can have 3 meals a day for their bodies, education and culture for their minds, and dignity, equality, and freedom for their spirits. So if you want to learn more about some of the work that we do, I'll point you toward this article, A Prescription for Community Health, where it really describes some of our approaches that have been ongoing to advance both nutrition as well as nutrition security. And with that, I'll just conclude with saying that every program that we deliver addresses social drivers of health. I mean, I think this is that's the key. You have to do that. And then bridging food insecurity and food security and social drivers of health, it takes all of us. And in my humble opinion, it takes all of us working together to advance evidence-based solutions. And so our group is really trying to create that evidence base along with many of you in the room in partnered programming. So with that, I'll say thank you so much. And this is many of our team members on the left, and those are my boys and my wife on the right. Thank you.
Going to see if there are any questions for Dr. Yes, please. Dr. Olivia Nathan, please go right ahead.
I live in that community. I don't know if these conversations have been had, but I was just curious about how we can leverage this information to put more grocery stores for community members to access, because there's a lot of resources to the pharmacy and other resources you mentioned, but I don't see a lot of grocery stores, and I wonder how that might be impactful for residents.
Yeah, critically important. And I know at Ohio State, we've been working over the years. This has been a long-term conversation about trying to drive a grocer to that area. And we, Chike Daubeny kind of leads a lot of that work at Ohio State. It's still on, right? You can still hear me? Okay. Chike Daubeny leads a lot of that work. And so, I can't say that we're there today, but that definitely is on the agenda and trying to get that done. Some of the things that we've been trying to leverage, there are a couple of hospitals around the country that, when they look, okay, take a step back. When you look at the grocery stores, what they do is they go in the community, They understand the community, right? And then they say, okay, how many people can buy groceries, et cetera, et cetera, et cetera, right? Because it's a business, right? But one of the things that's interesting that some communities have done around the country is they use the hospital employees as part of the community. And that can help support bringing in a grocery store. So we're thinking about some interesting solutions to try to get a grocery store into the area. Yeah.
Other questions? I know there's an interest in the QR code. Is there any way to go back and bring that up or minimize the one screen?
Or the cooking, let's see here.
Maybe minimize
There you
your visual
It's okay, I'm not visual.
at the top. You might be able to slide it over.
Yes.
There you go.
All right, all right.
Any other questions? As I said, the doctor has to leave to go coach the soccer team. So Dr. Joseph, thank you very, very much. Let's give him another round of applause.
And next we're going to hear from Amy Headings. We heard a lot about the Mid-Ohio Food Collective and the partnership between The Ohio State University and the Mid-Ohio Food Collective, Primary One Health, and I know that Franklin County Public Health also have collaborations with the Mid-Ohio Food Collective. We're proud to say that we were their first partner with their food tracking, nutrition tracking, and pharmacy program. And so it is my pleasure to introduce Amy Headings, who is the Director of Research and Nutrition at the Mid-Ohio Food Collective. And I'm going to turn it over to Amy now, and she's going to come up.
Everybody, thanks for having me today. And yes, thank you, Charlie, and thank you, Dr. Joseph. We do collaborate with many healthcare partners in the community. And so today, first of all, I just wanted to give a brief overview of the Mid-Ohio Food Collective and some of the work that we do. One of the things that we did in 2020, which wasn't super great timing, was we rebranded from the Mid-Ohio Food Bank to the Mid-Ohio Food Collective. Some of you know that, but I am just going to go through some of the work that we do high level. We have 5 assets. And one of the things that's important is that the theme of food is health is really woven throughout each of the assets. The goal for us is really to work toward improving the diet quality of all of the customers that we serve. And so we do that in several ways. The first thing I want to go through, though, is just really what is our service territory. And so we do serve Franklin County, but what some people don't know is that we serve actually 20 counties in central and eastern Ohio. And so for us, it's a very interesting approach because not only do we serve like urban Franklin County, but we also serve rural Appalachia and rural non-Appalachia. And so we have to be really sensitive to the needs of all of the people that we serve. We do that through over 600 partner agencies, and a partner agency would be someone like a food pantry, a Mid-Ohio market, after school programs, senior meal congregate sites, and other emergency feeding sites. In fiscal year 23, we served over 500,000 unique individuals across our service territory. And one of the things that is really important to know is if you encounter anyone and they're looking and they need food, the best resource for that is to go to freshtrack.com, and you can type in your zip code and it will tell you all of the places that are open that week that are within that zip code that can serve you. One of the other unique things that is important to know about all of the food banks in Ohio is we are all connected on the same software system, and this will become more important later in our later in what I'm talking about. But it helps us really to serve our customers better, because instead of someone having to come and bring the same paperwork over and over and over again, they can bring it once a year, and we can do that intake, and then when they visit a pantry later, they don't have to continue to prove that they're the same person. Let me see here. And so, like I mentioned, in 2020, we rebranded to the Mid-Ohio Food Collective, and we worked through 5 assets: the Mid-Ohio Food Bank, the Mid-Ohio Farm, the Mid-Ohio Pharmacy, which is my core work really at Mid-Ohio Food Collective, Mid-Ohio Kitchens, and Mid-Ohio Markets. And so I just wanted to go kind of briefly over what the work of all of our different assets are and how we all support food is health in the community. Okay. So Mid-Ohio Food Bank. So this is really our core work where we acquire food and then we distribute it to numerous pantries throughout not only Franklin County, but also to the community. And so in fiscal year 23, we acquired and distributed approximately 80 million pounds of food. And we are really encroaching on now about 70% of that is fresh food. Not just produce, but also dairy, also bread, meat, and other perishable products that we're trying to get out to the community, really because we know that outside of the grocery store, those perishable products are really the goal for improving health. One of the things that you may or may not know about us is that we actually have a farm. And so we have 2 farm sites, the Mid-Ohio Farm. We have one site that is actually behind the NBC4 studio on Olentangy River Road. And then we have another location that's on the west side of Columbus in the Hilltop. It's approximately about 10 acres and it's been undergoing a lot of construction recently, but I think we're at the end of that. And so we're going to start growing some we're going to start growing this year, and they are already growing things. And one of the important things about the farm is really to hear the voice of the customer in what we're growing. And so one of the things, for example, at NBC4 is surrounded by some apartments, and there were people from a lot of different African nations actually that were growing products on the fences around the farm. And so we were like, why don't we actually make some beds so that they can have some real places to grow food that's culturally relevant. And so we did. We created some growing beds, and so now that community is able to go in and have a place to grow foods that are relevant for them. And not only that too, but we're also taking feedback from the community that lives around not only that farm, but also the farm on the hilltop to understand, how do we grow foods that are culturally relevant? And as well, not only to grow foods, but also to be a teaching location for other places to show different methods, not just in ground, but also how do you grow food in towers and how do you use other methods for growing beyond traditional methods. And so with all of that, we are getting fresh, healthy produce. I think I heard this week that some of the harvest, it was like 15 minutes from the farm to market to actually in someone's cart shopping. So it's really how we work together as a collective to address the needs of the community. The Mid-Ohio Pharmacy Program. So I'm going to talk a little bit more about this and kind of our partnership with Primary One Health, as well as many other partners. But this is really our link. We know that food is critical to improvements in chronic conditions, and it really drives everything that we do at Mid-Ohio Food Collective. And so the Mid-Ohio Pharmacy Program is really our connection with healthcare providers. And how do we work collaboratively for the healthcare provider to really help individuals understand that food is important, and how are we the resource of that food, of that healthy food in the community? Let me see here. So the Mid-Ohio Kitchen. The Mid-Ohio Kitchen is our prepared foods program. And so we, through the Mid-Ohio Kitchen, I think we were at about 400,000 plus meals that we prepared throughout the course of the year. And so those are going to after school programs. We have a couple of National School Lunch Program contracts that we do. And then another thing that we're newly doing actually is some grab and go meals. I was over at the market at Norton Road on Thursday this week, and I saw chicken cacciatore as a prepared meal and collard greens. And so when someone's shopping in the market, they can just if they don't feel like making dinner, they can take that, they can take it home, they can heat and eat for their family. And so we're really trying to provide some options for people that are easy because we're all busy. All right, and then finally the Mid-Ohio Market. The Mid-Ohio Markets, we have 8 total Mid-Ohio Markets right now. And so when the Mid-Ohio market concept is really a grocery store type of experience. And so we're trying to, speak about them really as a market. Excuse me. And these came about from some conversations that we had with customers across Franklin County. And this happened probably in like 2015 or 16. We were really trying to figure out like, how do we approach this differently? And so as we talked to community members, one of the things they said is that we need more access. We need access more than once or twice a month. We need access like every week. And not only that, we want fresh food. And so, and we need open hours, because one of the customers said, it actually costs me more money to visit the pantry than it does for me to go to the grocery store, because she had to take off of work, she had to find childcare for her child, and then she had to find a way to get there. And so it was really eye-opening for us. And so to take that feedback and to put it into the development of the Mid-Ohio markets, we really try to listen to what community members are saying and how we respond. And so out of that has grown the Mid-Ohio market model. Okay, and so how does all this come together? And so Dr. Joseph so well talked about food insecurity and nutrition insecurity and some of the work that they're doing. But as we see here, food insecurity in Ohio generally, and then in Franklin County as well, it continues to increase. We saw a dip for many, many years up through about 2019, and it really stabilized during the pandemic because everybody was throwing all of the resources at addressing food. But, in the last couple of years, we've seen it increase. And so why is that important? One of the things that we know is that with greater food insecurity, there is greater prevalence of chronic disease. And so we take that to heart at Mid-Ohio, and like, how do we step in to help break that cycle? And so this other picture that you see right here, I'm sorry, is what we know really as the cycle of food insecurity and chronic disease. And so it's really like a snowball type of effect, where you have someone, let's say, for example, that this individual would have diabetes, and diabetes takes a lot of management. It takes visits to the physician, it takes medications, it takes food management. And so when you have all of those things going on, and then you're worried about where you're going to get food, you have increased stress, you may not be able to afford your medication, so resulting in poor diabetes management. Poor diabetes management generally means more trips to the physician, more medications and things like this, and just kind of a snowball, not necessarily well-controlled state. And so we have the opportunity here as food banks and other community resources to break that cycle by providing food so that that is a worry off of individuals' plates. And so this really drives a lot of the work that we do, is trying to break that chain of food insecurity and giving people access to the foods that they need in order to improve their health. And so I'll talk briefly here about the Mid-Ohio Pharmacy Program. This is really one of the things that we have leaned into, and it's a partnership with community-based healthcare organizations, and not only community-based healthcare organizations, but also big organizations like OSU, Ohio Health. We also partner with several managed care organizations. And so we work with the healthcare provider to screen individuals for food insecurity and then help them get access to the foods that they need to improve their health. And as Charlita said, Primary One Health really was, they've been in this boat with us for many, many years. And so we started this program initially with Primary One Health a long time ago. It was in 2011 when I first started at the Food Collective. I really didn't know. I was like, okay, we're just going to do this. And I didn't really know what was going to happen. But we did start by with a research study, actually. And we provided food to individuals. It was probably about 200 individuals for a period of up to 3 years. And one of the things that we found out from that is that food makes a difference in people's health outcomes. That we saw that in what the clinical outcomes were. We had lower hemoglobin A1Cs in that study. One of the other things that we did during that initial time period was, we really had some focus groups with the individuals that were participating. And they also said, hey, you know what, my whole family eats out of the food that you're providing us. So family access was really important, and the produce was really important. And so we also learned that just really broadly, there was no systematic food insecurity screening going on at that point in time. So that was really the beginnings of the Mid-Ohio Pharmacy Program. And so from that, we've had a lot of bumps along the road, and we've had a lot of development of this to where today what we're able to do is work with our healthcare provider who, and Primary One Health does this so well, screening patients that come in for, do you worry if your food's going to run out, or did your food run out before you had money to get more? And linking that resource of the Mid-Ohio Pharmacy to patients that are in need of food. So this is briefly just how the pharmacy program works today. We work with our healthcare providers to screen. They send us a referral. We get that referral linked up in our system, and then we're able to communicate with the patients in order to get them the food that they need. And then we're able to link that data back to see if health outcomes are improved with this program. Here's just a brief list of our current partners. And so we do partner with many, many organizations across the community. And right now we're working to expand that out into some of the other counties that we serve, as well as other food banks across the state. Here's some just early clinical outcomes that we had with a student that worked on this for a project that he did for his dissertation. And what we saw was that, one of the things that's really hard to understand is what's the impact of just broad food access on health outcomes, not necessarily like a very specific intervention. When he looked at this, what he saw was that for individuals that had a body mass index of 30 or more, we saw an improvement in weight of about 3%. And we saw a reduction in primary care costs of about 10%. And so that's part of the work that we do. It's really, I think, the crux of what we do, but we do have a lot of other work that is going on that partners the Mid-Ohio Pharmacy Program with other things. For example, like some of the initiatives that Dr. Joseph talked about, the LINK study and this upcoming SUSTAIN study. Another thing that, that we do have in partnership is one of the things that we were struggling with at Mid-Ohio is how do we provide more accessible nutrition education? Because we've done that in the past, and I know, Garrett, that you provide nutrition education to many of our patients, but we're like, what can we do that meets people's needs outside of the 8 to 5? And so we called WW, Weight Watchers International. We're like, hey, what would you think about partnering with an established produce prescription essentially program? And shockingly, they said yes. They're like, yeah, we'd like to try that. And so for the last, I would say, year and a half, we've been partnering with WW International to provide Mid-Ohio Pharmacy customers with the opportunity to enroll in WW if they so desire, for a year of all of the coaching sessions, free access to the app and everything. And so it's really trying to leverage the strength of both of what's that called? The reach of both of our partners. And so how do we better collaborate together? And I will say that all of this really is like, we're all doing such great work. And a lot of times it's really just figuring out how we work better together. And so, but most importantly, and especially in any of this work, is to really to understand what the needs of our customers are and to listen to what they say and to take that feedback and to make improvements to the programs that we do. And so we try to do that on a regular basis. I'm trying to get out to the pantries, and with our WW partnership, we listen to, what the needs of the community are. And so with that, thank you so much to everybody that's here to listen to how food insecurity is a real issue. And we at Mid-Ohio are attempting to do everything that we can in order to improve the diets of the people that we serve.
Questions, if you're okay.
Yep.
After Garrett's presentation, so that you all can kind of think about which questions you want. I do want to introduce a couple of people from my team who are here. We have Nicole Gomez Otaiko, who is our Chief Patient Experience Officers, and her relatively new husband, Thomas Otaiko. And then we have our Chief Community Services Officer, and that is Andrea Wilson. And then I introduced Dr. Nathan earlier. I see that we have our intern, Katia Coburn, who has helped our
Development and Marketing Manager, Susan Brewer. She had to leave, but because we have another event. So the one little plug I'm going to put in is we have a health fitness fair with Urban One at St. Stephen's, one of our partners, and that's where one of the Mid-Ohio markets is located at St. Stephen's Community House. That's at 1500 East 17th Avenue. We're going to be leaving here and going there for that health expo and fitness program there at St. Stephen's. And this is in conjunction with Minority Health Month. April is Minority Health Month. It is a 30-day concentrated effort to educate the public and to eliminate health disparities amongst racial, ethnic, and cultural populations who are experiencing those disparities. And then I want to thank our IT expert, our director of IT, Jeff McLeod, who is here as well. I really appreciate our team members being here and our partners in the community who are here. We're going to have everyone introduce themselves in a little bit. And then finally, before I bring Garrett up, who is one of our team members, I do want to share that this morning's breakfast items were provided by the Freedom a la carte. It's a nonprofit organization that supports individuals, mostly women, but men and women who have experienced violence, domestic violence. And they are an organization that has a restaurant on, is that Long Street? No, Spring Street downtown. And then they also do catering. One of the efforts that we have tried to promote here with these community health advocacy forums is to promote small racial, ethnic, and cultural businesses that provide food services. We want to grow them, we want to lift them up, we want to promote them at these events so that if you have an event, you can utilize some of these caterers and businesses in our community. And with that, I'm going to introduce our next presenter, and his name is Garrett Davidson. He is the manager of nutrition and dietetics at Primary One Health. We are happy to have him present next. Thank you, Garrett.
Well, good morning, and thank you for having me here today. So yeah, I'm the nutrition program manager at Primary One Health, and I'm just going to tell you what we're doing here at Primary One Health to help address food insecurity for our community and our patients. So there's some overlap between what Amy talked about and Dr. Joseph talked about, so I'll try not to repeat too much. But we'll talk a little bit about food insecurity, nutrition security, that relationship between food insecurity and chronic disease, what we're doing from a community perspective to address it, but also what our dietitians are doing to educate the patients. So food insecurity, simply enough, lack of consistent access of enough food. Nutrition security, better defined by Dr. Joseph, but here's the USDA's description of it, really just having enough food, but also it being healthy to support their well-being. I didn't know there was updated data on the insecurity rates, but apparently there's 2022 data. I have 2021, but it looks like it's 12.8% now. So it has increased. I wouldn't be surprised if 2023 has increased too. But relative to what we're seeing at Primary One Health, we're seeing quite a bit of people with food insecurity. We're screening them to identify that with the Hunger Vital Signs screening tool, which is these 2 questions. If they answer often true or sometimes true versus never true, really saying if they're worried in the past 12 months of running out of food, or if they did run out of money to not purchase enough food. But we see about 22% that screen positive for that Hunger Vital Signs screening tool. And that captures a good amount of those patients. And even if we were to take that false positive rate away, it ends up being 18% of our patient population is food insecure, which is still 60% more than what we're seeing in the Franklin County area. So that really tells us that Primary One Health really has that access to those patients, and we're really in a good opportunity to reach them and address this issue. Food insecurity and chronic health conditions. Poor diet quality is definitely a part of it. And that's going to definitely impact a lot of our other health conditions, you know, diabetes. When they have diabetes, the poor A1C rates, obesity, and specifically it's more noticed amongst women for some reason, cardiometabolic diseases. And now the association between food insecurity and the association here with these diseases, we're not sure if it's causative. We suspect so, but it's perhaps, you know, negative health outcomes can lead to more financial constraints, which can then come back into it. So we don't really 100% know the mechanisms, but it is important. These pharmacy cards are what we provide all of our patients with, but we really help direct anyone who does screen positively for the Hunger Vital Signs screening tool on how to get to these pharmacy programs so they can reach these this produce, get it weekly, because most of us do go to the grocery store weekly, right? So chronic disease is not fixed in one occasion. We have to keep doing it, and that's where that pharmacy card allows us to really address it from a weekly perspective. We also work with the Mid-Ohio Food Collective in doing these produce markets, where we have amongst, I think, five of our locations, Circleville, and some of our bigger locations in the Central Ohio area or Columbus area, Agler, Parsons, East Maine, as well as West Broad. So they stop by and we have a bunch of produce to give to them. As you can see, this is some of our staff doing so. This is the program where I'm most excited about because it's something new and we're seeing some innovation here, is where we're able to provide patients with produce right when they're getting the care. And I think that's a really good opportunity to really just access them right then and there. They don't have to go to 2 places. Transportation, we know, is an issue in these scenarios. So it allows us to really help these patients. It all started with our Cardinal Health Foundation grant, where we started with 3 of our locations: Parsons, South High, and Sawmill. So it allowed us to really address that for the food insecurity for people with diabetes and pre-diabetes. We were targeting them specifically because that association with food insecurity, addressing hemoglobin A1C and glycemic control, is clear. And in fact, we do see within our own patient population, those who are food insecure have a higher rate of diabetes. It's 26.2 versus those without food insecurity, which is 22.5. So we have been doing that successfully, and now are expanding that program with the Healthy Pantry to Go. And that's where we're going to start doing some deliveries to these patients. We're going to be partnering with DoorDash, and that is going to allow us to deliver within a 10-mile radius. We have also expanded to 5 more sites, including West Broad, East Maine, East 17th, Agler, and Circleville. And now we're also going to be giving these patients with a BMI of 30 or greater, or what's typically associated with obesity, so that we can not only help them prevent the progression to diabetes, but hopefully help them with some weight management in the process too. And the reason why we're doing this delivery perspective is because when you have food insecurity, financial issues are common things. So transportation barriers can exist. So we really want to overcome that transportation barrier and get them that food that they absolutely need. And then finally, our dietitians. We work with patients regularly to address their individual needs and, you know, help them with food choices to lower their hemoglobin A1C, manage weight, hypertension, high cholesterol, all those things. And we do notice that some patients, not only do we not capture them in screening, but we help identify that they might not flag positive for this screening. And we start to talk about finances and the ability to make these changes, and we see food insecurity as an issue. So we try to address that too. We use that freshtrack.com that Amy was talking about, in which we show them those nearby locations that they can really seek that food. We also connect them with a service, the Office on Aging, in which the nice thing about this program is that there's no financial constraints, because there is a gap between finances to being able to get the emergency food assistance program and having food insecurity. And it's great, but it's specifically for people of age 60 or older, but it is home delivered meals, and anyone of Franklin County resident, no income restrictions required. Then also, we just really want to educate them on access to these healthy foods, encouraging them on these decisions, maybe busting some myths with certain things, and encouraging that, hey, we have starchy foods that are available, things that provide you with energy and calories, you know, through potatoes, peas, beans, and lentils. We have protein-rich foods like eggs or peanut butter or tofu, if that's the route you'd go, or canned fish. We also have grains like brown rice, quinoa, and oatmeal to help us, as well as go into some more shelf-stable versions of produce. Canned and frozen fresh produce can really help us. Encouraging in-season produce. Not only is it cheaper, but it is going to be better quality. We're going to also encourage them to just prepare more foods from home, and how to do so in an easy fashion, especially with their, busy lifestyles. We all have that. So it's trying to help them do that also in a culturally competent manner. And then really just encouraging minimally processed foods. Minimally processed foods are things like, the way they came from the ground, fresh produce, lean meats, things like that. The further it looks away from the way it came, the more highly processed it is. The thing, we tend to overconsume those. Overconsumption leads to overconsumption of carbs, calories, and thus exacerbating those issues we talked about. But that is all I've got. And I think now we'll pass it over to questions.
Let's give Darren a round of applause. We really appreciate our nutrition team at Primary One Health. They're doing an excellent job, and certainly the partnerships are critical. I also want to recognize Yvonne Banks, who is a team member of Primary One Health, and she's with our quality team, and we really appreciate her being here. With that, I want to open it up to questions of our panel here. So anyone who has a question, please raise your hand. Yes, I'm going to bring the microphone back to you.
Hi, I'm Jen Forbush. I'm a faculty member at the OSU College of Nursing. I teach community health to undergraduates and grad entry students, so I'm always looking for information to share with them. One of my biggest worries or questions is long-term outcomes. You have a lot of great studies going on, and you've shown some decrease in A1C and some decrease in weight. How far out are you looking? And is there anything else that you're looking at in terms of health and chronic instability, whatever it may be?
Yeah, so that's a great question, and it's one of the ones that is probably hardest to address. So, thank, our partnership with Primary One has really been the longest standing partnership, and they have definitely just been in this work with us, you know, wholeheartedly. And so right now, we're actually in collaboration on some work to look at the last 8 years of, you know, what does food access, the impact of food access on health outcomes. We're partnering with the same person that did that initial work to look at it, but you're right. It's hard to understand that. Not only that, but all of the confounding factors too that play into that, food access from grocery stores, other things, and so that work is ongoing. We literally just got the paperwork figured out with John. And so I hope that he's able to align some of the information so that we have a better understanding. I think that it will be really the largest look at the use of the emergency feeding system and health outcomes ever. I don't think it's ever been done, to be totally honest. So great question. Stay tuned to how it will turn out. I'm supposed to have a call with John in the next couple of weeks.
Right here, if you would introduce yourself.
My name is Doreen Reed, and I have a nonprofit called People as Two Outreach. We go out to the community to serve those that are living on the land. And my question is somewhat, while you have some great programs going on, that's wonderful. But my question is there any initiative to the unhoused? Because that population is continually growing, and I'm not trying to put anybody on the spot. I'm just trying to see what are the initiatives in Franklin County that may be addressing the needs for those that are unhoused and not able to get the proper diet that they need.
I can share one program that Primary One Health initiated several years ago with Make a Day Foundation. It was working with them going out on the land with our mobile health unit, their mobile food unit, to provide food to people on the land while we provided access to healthcare. And so this is a partnership where both organizations were going to the camps that we knew existed and providing, in some ways, encouraging individuals who were hungry to come over to the two trucks, the two mobile units, so that they could get food. And I heard the food was really good, and then also get their healthcare needs met. So that's one that I know of, and I'll turn it over to the panel.
Yeah, that's a great question. At Mid-Ohio, we don't necessarily have things that go out to the unhoused, but we do have our community meal that's going on at the Reeve Avenue Center. And so is it every day? I think it's every day. There are meals that are made there, and anyone, it doesn't really matter if you're unhoused, if you live in the community, is able to come in to get a prepared meal. A lot of them are really kind of like grab and go type of meals. And so that's one of the things that we're doing to address the needs of the unhoused in the community. Also too, with our grab and go meals that are over at Norton Road. So although we don't have a lot of stuff that goes out to the unhoused camps, we do have some of those initiatives for foods that are actually prepared for people to eat. We also just are working on our food truck. So that's kind of something that's kind of new with Mid-Ohio, and I don't know like how that is going to play into the needs of the unhoused. I think that's to be determined.
And also on the south side of Columbus, Community Development for All People has a market that is open every day to individuals who are unhoused and individuals in the community who just don't have the resources to buy the food. And they provide that food for free. My church also provides food for free at Catherine's Cafe on Barnett Road, Christ Memorial Missionary Baptist Church. So we really have to look at all of our partners in the community, not just our healthcare partners, as entities that are doing what they can to help all of the residents of our community. Other questions? Yes.
Good morning, my name is Marla Williams, within the Area Commission, and I chair the Health Commission. My question is specifically for the Mid-Ohio Food Anchor Collective. What are you doing in regards to quality control, making sure the food is actually fresh? For instance, particularly in the Linden Market, there are no other grocery stores really in that community as a whole. There's a small Save a Lot all the time away, but nothing really accessible for those who do not have transportation. And the food that is there, you can tell that it's on its last leg for the most part. So it's for the individuals that are able to access it, they really have to eat it in that day or two, or it's going to go bad. So what are we doing in regards to quality control, the food that's being dispersed, and also accessibility? Because I believe they're only open one day to 7 p.m. So if you're employed first shift, there's no way for you to be able to truly access that store. So what are we doing for people who are employed by say first shift to be able to access food?
Yeah, that's a great question. So the Linden Market is an independently run grocery store, so we don't run the Linden Market. So that would be, I think, the question for the Linden Market in terms of the hours of operation. But in terms of your question, we do have, I know that it's not necessarily right next door, but we do have the Mid-Ohio Market at St. Stephen's, which is up the road. It is open several nights until 6 p.m. So that is one thing to know. In addition to the Meat Map, which is not that far from the Linden Market, also has some additional hours of operation. They also just installed a locker system at Meat Map, so you can do online ordering for a locker pickup there. And so I think that the most important thing is to use freshtrack.com to figure out, like, if it isn't the Linden Market that's open, then what else might be open later to meet the hours when I have a car or when I'm not working or anything like that. In terms of the product, that's a great question. Some of the product that does go to our agencies is through what's called the retail pickup program. You're right, it is sometimes, the market will actually pick it up from local organizations. But the other flip side of that is that we do deliver produce to the Linden Market from Mid-Ohio that we get through either the Ohio Agricultural Clearance Program or other, TFAP type of produce. And that's coming not necessarily from the local retailers, that's coming through some of the ag clearance purchase. And so that does get distributed there. I don't know with what frequency it actually goes there. And so I don't know that that's a great answer to your question, but there's a lot of produce streams that are coming in to the Linden Market and other places.
Any other comments? If not, we'll see if there are other questions from the audience. Yes. Mr. Brother Cecil, hi.
Hey, thanks for being here. Why is the focus more on diabetes than heart disease and high blood pressure?
Yeah, I think that's a good question. Part of it is from funding. Funders really want to target diabetes, so that's what we're trying to do. We do have a lot of research to really support the food insecurity being addressed and how that does have an impact on diabetes. So that would probably be that main purpose.
That is a great question. I think diabetes, it's interesting because we know now that diabetes and high blood pressure and a lot of the cardiometabolic, just the whole circle, it's all related to each other. And so we try to provide fresh food, which is really a component of not only diabetes control, but also blood pressure control. One of the things that Mid-Ohio is just we're just like getting into this, since we're one of the sites selected to put an American Heart Association blood pressure station. And so, that's gonna go in at one of our Mid-Ohio markets to give people the opportunity to just self-screen for blood pressure, and then to have, partner healthcare, so that partner healthcare organizations where if it is high, that they can have a resource to get treated for high blood pressure. So that's pretty new. I mean, we're just like getting still wet on that one. So I hope that it does provide an opportunity for individuals to become more aware of blood pressure and South Florida.
Thank you very much. Other questions? If there are no other questions right at this point, I'm going to send the microphone around. If everyone would give us their name, their organization, or if they're representing themselves, that would help everyone get to know each other. One of the reasons we conduct these quarterly forums is to introduce community to each other and look for partnerships. We don't know everyone in the community, and sometimes there is a need for a certain level of expertise, and we might find it at one of these forums. So we're going to start at this table here, and if you would introduce yourself.
Yes, so my name is Morris Ellington. I'm the president and founder of AZ Collective Foundation. Foundation really honestly started off a couple of years ago in regards to really leaning more towards the athletic community, namely what everybody heard about that. But we got more over time, during that time to today. More so focusing a lot of just students, college students in general. So scholarships and helping our athletes anyway to get out to the community and pretty much really bringing that to give it back to the community. So yeah, more so.
Louis Bandus, I'm the president and CEO of Lake School Eagle Solutions. We actually have a partnership with Skyward RX, which presents the Abundabot program. The Abundabot program actually provides healthcare access, resources, food insecurity, addressing social determinants of health. And that's why we're kind of like, what's currently in the community, and then how else can we be a part of that and partner with, Mid-Ohio Food Collective, primary ones of that nation.
Good morning, everyone. I'm Mara Logan from the Central Area Commission.
Good morning, my name is Olivia Nathan. I am a pharmacist by training and the director of pharmacy at Primary One Health.
Hi everyone, I'm Yvonne Banks and I'm with Primary One Health on a quality improvement team, and I'm also a doctoral student at Franklin University.
Good morning, I'm Nicole Otaiko, and this is my, unfortunately, slightly abused husband Thomas after I still hit him in the head earlier, but I'm with Primary One Health and we're happy to be here. I'm the Chief Patient Experience Officer. I'm Andrea Wilson, the Chief Community Services Officer with Primary One Health. Hi everyone, I'm Amanda Parks. I'm a Development Director with the American Heart Association here in Central Ohio. So just happy to be here. You know, we work alongside a lot of the organizations represented. So happy to chat with anyone after. A lot of you might know my colleague Diana Briggs. She's our Vice President of Community Impact, who typically comes to events like this that we're divinely conquering this weekend. But happy to be that partner in heart health and all things.
My name is Brother Cecil and I am the president and CEO of a group of men and women in the movement. And our mission is being concerned about the conditions and quality of life in our community. We're kind of like boots on the ground and support a lot of different organizations, really messages and things like that out. And I'm also a small business owner and facilitate some of the facilities that Primary One is associated with Primary One and Primary One Health, yeah, make that clear. For a number of years. So we thank thank them for supporting us, and that's what we do.
Hi, I'm Jenny Sherwood, a registered dietitian, certified dietitian and education specialist at Ohio State University Wexner Medical Center. And specifically, I'm on the Accelerate Research group, which is led by Joshua Joseph. I'm happy to answer any questions that anyone might have about the work that Dr. Joseph talked about. And I'm also here with my colleague, Dr. Amaris Lovins. Hello, I'm Amaris. So in addition to working for OSU, the founder and president of a nonprofit called Nexus Breakfast, and we do YouTube videos on vitamins and hydrogen and friendly recipes. And it's free obviously on YouTube. So check us out at Nexus Breakfast. I'm Olivia Zoe, and I'm an undergraduate student at Ohio State. Good morning, I'm Kristen Peanut. I'm the patient navigator with the Moms to Be program. We're a program of OSU Wexner Medical Center. We work with moms that live in Franklin County to hopefully help them have a happy, healthy pregnancy and raise baby happy and healthy up to their first birthday. And obviously food insecurity is something that we know affects birth outcomes. And then unfortunately, food insecurity is something I see with a lot of the moms we work with. So I was just here today to learn a little bit more. Thanks. Good morning. I am Deborah Johnson, and I am the partner in service and board chair of the University Catholic Ministries. We service those who are unhoused, and that we here and to receive all the information that would be helpful for us to provide for those who are struggling with housing. Hello, my name is Eureka Reed of the Bliss to Outreach Ministry. I am founder and executive director. We will be July, will be actually 10 years, so we can serve in the community. And for those that are dealing with unhoused, we have been feeding on an average of 100 to 125 twice a month. We're making sure that they have a full balanced meal, hot meal, because I think that's important, as well as some takeaways with sandwiches and different items to take with them. But that's only twice a month. So my goal is to try to see if we can expand or connect with other community partners that we may be able to kind of meet the needs of those that are dealing with unhoused. We also have transitional housing for those that are working homelessly, that are dealing with working. They're working but unhoused, cannot get traditional housing. So we work with them on a regular basis to ensure that they have the skills and the means to continue without falling back into that situation. Hi, I'm Jen Forwish. I'm a faculty member at the OSU College of Nursing, working primarily with community health students. So I'm always here to look for partnerships and if folks need groups of nursing students to help them with projects or help do some health assessments. I'm listening to everybody and what they do here. I'd be happy to connect. We're always looking to partner with community agencies to help our students see what's out there.
Hey, good morning. My name is Jody Blacksher. I actually work with Optum, which is the division of United Health Group. For many years, I worked on our Medicaid side with being on health care. So I've been out of touch a little bit, so I wanted to come out and just see what's going on in the community as far as around social determinants of health. Even though I work for Optum, which is more of the actual care model, 49 health group, and I see to working with a lot of skilled nursing facilities. But just wanted to be a part of the community conversation this morning. So thank you for having me.
Thank you for joining us, and I'm going to have the folks over here introduce themselves.
I'm Jeff McGlade, I'm IT for Primary Health.
I'm Katya Coburn. I'm the marketing intern for Primary Health.
Any closing remarks before I give some last remarks?
Thanks, everybody, for all of the work that you're doing. I just think that it's evidence, like the cross collaboration, nobody can do this themselves, so I'm just really thankful that for everyone here that's trying to put forth and like lift up the needs of the community and how can we put aside whatever, you know, challenges we might have and just work together the best way to meet the community's needs.
I'm gonna be succinct here. Yeah, I agree. It's great to see a lot of people out here, interested in really helping these people, so.
Thanks, everyone, for joining us today. I've got a couple of announcements. The first, one of our guests talked about scholarships for students. We do an annual signature fundraising event. We only do one really fundraising event each year because it takes a lot of time and energy. But I created this event back in 2015 when I started with Primary One Health. It's called our Healthcare Justice Awards. And we give 2 awards, one for an internal staff member at Primary One Health, and then we give an external award. One of our partners, it can be an agency or an individual. And that is to raise money, and the money now goes to our Healthcare Justice Scholarship Fund. We are trying to create an endowment so that we can give scholarships for individuals who are either entering the healthcare professions or advancing. They may be currently a medical assistant and they want to become a nurse, so that we can provide scholarships. The foundation is housed at the Columbus Foundation. Our dollars are housed at the Columbus Foundation. We gave our first scholarships last year to 6 students, and we plan on giving additional scholarships this year. So that event is Thursday, October the 3rd. It will be held at The Ohio State University Student Union Archie Griffin Ballroom, and it will be from 6 until 9:30 p.m. Again, it's on a Thursday. This is our signature event. All the money that is raised goes to that scholarship fund. So spread the word. You have a little flyer on your desktop. You also have our quarterly newsletter. We do a quarterly newsletter. We've been doing that since 2015 to the community, really sharing what we've done in the last quarter. This is the first quarter of 2024, and we highlight some of the programs of Primary One Health. I want to thank everyone for being here today. I want to thank our partners who are doing an absolute fantastic job in the community. We really love our work with the Mid-Ohio Food Collective, with The Ohio State University, and certainly our own Garrett Davidson and the work that he and his team are doing at Primary One Health. Again, we do have an event over at St. Stephen's Community House. It started at 10. It will go until 3 p.m. And this is the Health Expo and Fair out at St. Stephen's Community House. It's a partnership with Urban One and Primary One Health. Thank Franklin County Public Health and Commissioner Joe Mazzola and his team for helping to put today's event on. And everyone have a safe weekend. Great.